What landmark is used to determine where the subclavian artery ends and the axillary artery begins? Gabby here from bootcamp.com, and in this dissection, we're looking at the aspects of the anterior chest wall, as well as the more proximal regions of the arm. So here would represent where the arm is. So I know we're looking at the anterior chest wall because I can see some of the ribs here, as well as the intercostal muscles that lie in between the ribs. So the sternum would be somewhere along here, so this would represent the more medial aspect of the body. Here would be more superiorly where we have the head and neck, and then here would be more inferior where we have the abdomen and then the rest of the lower limbs. What we've done here as well is that we've actually reflected two muscles that are found on the anterior chest wall to better visualize some of the structures that are found in the axilla. Those two muscles include the pectoralis major and the pectoralis minor. And we can see here in the axilla, we can see a ton of nerves, and this is going to represent the brachial plexus and its branches. So we know that the brachial plexus is found within the axilla and then eventually travels more distally, where it will give off branches that will go and innervate some of the skin and the muscles that are found along the aspects of the upper limb. Now I want you to think which artery is tagged here and which artery is found in very close proximity to the brachial plexus. So this artery right over here is going to be the axillary artery. And we know that the arteries of the upper limb will eventually transition and become different arteries as they pass specific landmarks. So we know that the right axillary artery is going to emerge from the right subclavian artery. Now, because we're looking at the right side, the right subclavian artery is going to emerge from the brachiocephalic trunk, which itself is a direct branch off of the arch of the aorta. So the subclavian artery will emerge from the brachiocephalic trunk. It will continue more laterally right over here, travel underneath the clavicle, hence the name, right? Sub meaning under, clavian meaning clavicle, so underneath the clavicle. And then it will eventually continue on becoming the axillary artery, and then eventually the axillary artery becomes the brachial artery as it enters into the arm. So we're looking at the arteries themselves. We can't actually differentiate when one becomes the other. The way that we can do this is that we actually have other anatomical landmarks that are surrounding these vessels that allow us to differentiate the transition between the two. Now, before I talk about the border that determines the actual transition between the subclavian and the axillary artery, I just want to briefly go over the parts of the axillary artery. Because we know that there are three parts of the axillary artery, and the three parts themselves are also demarcated by specific borders. So the first part of the axillary artery, which will be right over here, is going to travel from this region all the way to over here. We're going to talk about this border in a second, but I'm going to go to this border first. So the more distal border of the first part of the axillary artery is going to be the superior border of the pectoralis minor. After this border, this area becomes the second part of the axillary artery. And remember that these parts help us determine the branches that are coming off of the axillary artery because we have different branches that are coming off different parts. Now, the second part of the axillary artery is going to terminate at the more inferior border of the pectoralis minor muscle. So right over here, past that point, this is going to be the third part of the axillary artery, and we'll continue all the way over here until it hits the more inferior border of the teres major, where it eventually becomes the brachial artery. And that will be at that point where it enters into the arm. So again, these borders help us determine along where on the vessel are we actually looking at, and also helps us determine which branches are what. Now I want us to go back to our question here. So where does the subclavian artery emerge and become the axillary artery? So if we have a look right over here, we actually see this muscle that originates along the first rib. So here would be the first rib. This muscle right over here is the subclavius muscle, which as the name implies, the subclavius is found underneath the clavicle, and it provides some structural support to the clavicle itself. So having a look at the first rib will continue like this and eventually travel more posteriorly where it will go articulate with the T1 vertebrae. So if we have a look at the first rib, so here is going to represent the more medial border or the more superior border of the first rib. And here is going to be along the lateral border of the first rib or the more inferior border. It does depend on how you kind of look at it. Like in this case, this would be superior and inferior, and then this would be medial, and then this would be lateral over here. So right over here along the lateral border of the first rib, the subclavian artery will transition and become the axillary artery. Let's go back to our question here. Our answer should be lateral border of the first rib.